Newsflash, we have 3 holes down there, medically called orifices. It's not a saying to know your body, so take a mirror and check it out. From top to bottom, you have the first hole, which is the urethral opening and is where you pee from. The second hole is the vaginal opening, where the penis goes in during sexual intercourse and the baby comes out from during delivery. And the last hole is the anus, from where you take a shit. Educate your female kids about these. You don't really have to use these words, but please be realistic. Welcome to Triple F with Dr. OBeLs. Please stay updated on my weekly posts by hitting the subscribe button and turning on your notification. Thank you. Young girls and women come to the hospital and complain about having a toilet infection after using the toilet. I've tried on several occasions to decipher what that really meant in relation to their complaint, and I figured out that the term toilet infection has been a misnomer for multiple infections that affect the urinary tract and the reproductive system, both presumed to be gotten from the toilet. That is not correct. The urinary tract from the outside to inside is made up of the urethra, the bladder, the ureter, and the kidney, and is one of the systems responsible for the removal of waste from the body in the form of urine. The reproductive tract, on the other hand, from outside to inside is made up of the vagina, the cervix, the womb or uterus, the fallopian tubes, and the ovaries, and is responsible for reproduction, or in layman's terms, baby making. So any infection that involves the urinary tract is called a urinary tract infection and includes urethritis, cystitis, or pyelonephritis. These infections can be gotten when microorganisms get into the tract and may be from the anus, during a poorly washed after poop, during sex, from an STD-laden vagina, through catheterization, low immunity, or if you have urinary tract abnormalities or conditions that make it difficult for urine to flow through, like in kidney stones. Symptoms of a urinary tract infection can range from changing color of the urine, pain or burning sensation while urinating, smelly urine, frequent urination, cloudy urine, low abdominal pain, or flank pain. Sexually transmitted diseases are infections that are gotten through sexual activities, from receiving the head to masturbation and sexual intercourse. They range from gonorrhea to chlamydia, syphilis, crabs, and genital herpes. I discussed this in 2 of my previous episodes, the queer relationship between blowjobs and STDs, and masturbation, the good, bad, and ugly. So please check in the description box for the links and watch them for more information. Most STDs do not have symptoms, but some women may come down with abnormal vaginal discharge, smelly vaginas, vaginal itching, low abdominal pain, and pain during sexual intercourse. To know if your vaginal discharge is abnormal, I made a full episode, the vaginal discharge you should worry about, and you can also find a link to that episode in the description box. If you present at the hospital and your complaints are in line with a urinary tract infection, we request for your urine sample to do a urinalysis and a urine MCS, which tells us what microbe is responsible, and if we suspect the infection may have gotten up to your kidneys, we may request for an abdominal ultrasound scan and a serum electrolyte urea and creatinine to assess the status of your kidneys. However, if our suspicion is in line with an STD, we may do a blood test, a high vaginal swab, and an ABDOMINOPELVIC ultrasound scan to assess the causative organism and the extent of damage to your reproductive organs. Both infections are usually treated with antibiotics, antifungals, or antivirals for 3 to 10 days depending on the microorganism responsible. So go to the hospital and get yourself examined and tested. Note, these infections are completely preventable. For the urinary tract infections, always clean from front to back and preferably wash with water after peeing or taking a poop. Drink a lot of water, try to pee after sexual intercourse, and avoid using scented products around that area. For STDs, ensure you use a condom during sexual intercourse. Advise your partners to clean the sex toys before using them on you. Your partner can also use a dental dam while giving you a head, and stick to one faithful sexual partner. Comment below if you have had any of these and how you treated it. Remember to also invite your friends to watch this video and learn something new to enhance their health just like you did. I will see you same time next week Friday.